literary success, but I'm not a literary critic, so I don't want to face with this aspect of her book. Her book for me, from my point of view, is a sort of tool for my job, because I teach history of medicine and medical humanities, and I think that with the hole in the heart is a good case to talk about narrative medicine. Narrative medicine is a new, maybe a very old method which aims to build a bridge between the scientific knowledge of the healthcare practitioners and the subjective experience of the patients. So it's an old method, because when medicine had not the scientific tools which it has now, it was the only way to deal with the patient, talk, understand, spend time with the patient. Now everything passed on the background. In this case, the patient, Sasha was the patient, and she was a very special patient because she gave a very detailed record of her experience of disease, providing also some very interesting suggestions for maybe a solution of many problems to improve communication, for example. So I've chosen the most important sentences in her book, according my opinion, obviously, but these sentences are the ones I will use next year with my students, the starting point of a common reflection we are going to share. So, the key word of this first passage is language. This is my wonderful translation. Sasha asked me if I wanted to have this translation corrected, but I prefer to mistake on my own.
It's perfect.
So, we know I work in a medical faculty, and there is also the hospital in the same environment. And we know that patients are more satisfied with the nurses' communication than with physicians. Physicians very often use a medical jargon which is very difficult to be understood. Nurses use an everyday language which is very easy to be understood. We can, for example, we can say the cause of this disease, and everybody understands. But if we say the etiology of this disease, it's the same meaning, but the words are different. Medical language has its roots in classical age, so it's an hypertrophic language. It's necessary to use a simple language if we want to be understood, because medical language is a sort of dance between two partners, the speaker and the listener. But both of them must know the dance steps, otherwise it doesn't work. And a clear and effective communication is always the core element of the clinical relationship. And I think that we must teach our students not to conceal, to hide themselves behind difficult words, because otherwise medical language becomes a sort of status symbol. I call it in Italian medicese, maybe medicalese in English, just to have more money during the visit. If you have used more difficult words, you have the opportunity to earn